I'm delighted to be speaking to Diego Sanchez today. Diego, welcome.
Thank you, Chris. Thank you
you're
very much
You're in Uruguay, so tell us all about that.
I am in Uruguay. I'm at home in La Pedrera, right in front of the ocean. We're enjoying the autumn.
Diego, you're one of these people who's traveled internationally. You teach internationally. You've studied internationally, right? You want to give us a little bit of background about your Shiatsu upbringing and current?
Yeah, well, I started training. I mean, I discovered Shiatsu with Japanese martial arts people when I was living in Paris. But I couldn't really find a formal kind of training. It was all, with this teacher, that teacher, but it's not very formal. So I moved to the UK and I trained at the Shiatsu College in London, which was amazing. At that time, we had a lot of really incredible teachers. And of all those great teachers, sometimes some of the teachings really caught my attention. And I asked, where is that coming from? And they said, oh, I learned this from Pauline Sasaki. And again, Pauline Sasaki. And I said, I really want to meet that person. And I went to meet her in New York. And I eventually ended up staying there and training with her for about 8 years.
Okay.
I shot a documentary about her work. It's called the Human Potential. You can find it in YouTube, or parts of it at least. And then, I had to train again in New York because they're very strict about, what is body work, what is massage, and Shiatsu is considered massage. So I had to learn massage and the whole other aspects of massage, to get a license from the state of New York. I took the Department of Education to court to get my credits, from other countries, but I only could claim part of it.
Wow.
But eventually because I had that training too, I guess, and I had the license, I could work in a hospital. And I worked in Columbia Presbyterian Hospital with Dr. Oz, who was a heart surgeon. And I was invited to help his patients with Shiatsu post-operatively. And then before operations, and then sometimes during the operations, if it was very complicated, like heart transplants or people that were in complicated situations. So I developed quite a bit of my skills by working under out of the ordinary circumstances of your Shiatsu studio, the futon and the gi and all that stuff. I like the fact that we can take Shiatsu, which is basically touch, to anywhere.
Yep.
And taking it to the hospitals was like the prelude to taking it to disaster areas. Like during 9/11, I worked at Ground Zero with the rescue workers of soldiers, firemen, police, and construction workers that were looking for for survivors. And eventually, I kept working with that, and I moved back to Uruguay about 15 years ago. And I always had interest in continuing with that part of the business, taking Shiatsu where it's most needed.
Yeah,
I worked in hospice. I worked with cancer support groups and with people in many different stages of disease and end of life. And but I wasn't really successful in getting back into the hospital environment until 2019. I was invited as a consultant for a foundation that supports babies that are not taken care of by their families, and they're not yet into the adoption process. And this was in a hospital, and I gave a a lecture and some tips, how to work with the energy of the babies and the carers and so on. And somebody from the hospital attended, and she invited me to work in the intensive care unit of it's called newborns, neonatology, the neonatology department. And that was amazing. We worked with I worked with a small team of my students at the time, and we managed to do about 800 one-on-one sessions in the ICU and in the intermediate care of premature babies. So then COVID came up, so we had to stop working there. And eventually, although I knew that they would need us more than ever, because the impact of what we were doing on the staff, on the medical staff at the hospital, was very, very, very strong and very beneficial. When COVID hit the system, they didn't know what to do, so they kicked us out just for safety concerns of everybody. But then it got so bad that I heard on the news, the director of the COVID intensive care unit, a hospital, they closed down and they reopened it especially for COVID patients. And he said, my staff is destroyed. They really need a boost. They need some support, and there's not enough hours of sleep that they can get that will restore them to their state. So I thought about, well, Shiatsu is right for this. And since we're in a small country, and I had already done some research on, how to get to this intensive care unit of the COVID support areas, I found the phone of this doctor, called him up and said, listen, what you need is Shiatsu. Let me go and give you a sample of how it works, and then we can make a program for your stuff. And that's how we did. I showed up with, I think it was 2 or 3 of my students, which are graduated now, and they had experience already in the neonatology department. And we gave them a session to right there and then, in the intensive care unit. So we didn't have to stop what they were doing. They just sat on a chair in the middle of the corridor. We gave him a Shiatsu on the back, shoulders, neck, head, and arms, and they just go back to work. The impact was so strong that, we didn't get hired because it was pro bono. But we organized to keep sustaining that support, especially for the intensive care unit staff. We did about another 800 sessions there in one place, and then we decided that, because throughout the country there were other intensive care units for COVID patients, there were lots of deaths and all this drama that came not only from the medical aspect of it or the patient aspect of it, but also because there were the resources that the human resources from the medical staff were really being drained. They had to do really extra long hours. There were lots of deaths, and then the people that were working, they were having to face death rates higher than usual. And the special thing about it was that family members could not go in. So the nurse and the doctor and the nurse assistant and the people that prepared food and the cleaning staff had to be the ones that supported emotionally that person that was dying.
So you were treating, like, right across the board, you're treating all of these people that you just mentioned?
Yeah, from I was trying to get the director of the center on the chair So everybody sees that he or she is buying this stuff, is accepting, is receiving what we do.
Yeah.
And then I work with doctors, nurses, nurse assistants, social workers, cleaning stuff, the people that work with the food, everybody that has anything to do with the service, because they were all living the same drama, even if they didn't have the medical skills to deal with it. Staff was dealing with so many deaths, but in I don't know, like they really felt useless, and in certain aspects, like with artificial ventilation. And when this became apparent, and studies proved that what they were doing was wrong, and it was actually making patients worse. It was a validation of what they had been experiencing over the months before.
Mm-hmm.
So we were dealing with that stuff, but we didn't have a label for that. We had a label in Shiatsu. It was lots of sadness, sense of anger, sense of isolation.
Yep.
This sense of isolation, which usually patients have.
Yeah.
And they had physical isolation, but anybody that has life-threatening disease gets isolated, socially isolated, because
Sure.
even the people that you love the most, they don't know what to do around you.
No.
So I've seen this for many years, but the staff that works with isolated patients, they also get isolated. Not only physically, because they have to take care of the protocols for coming in and out of the ICU, but also because these people went home and they had the worry that they might be contaminating their own family members. The good thing that I think that we could do by being in the workplace was that it was all sorted out. They didn't have to do any special thing to go and dedicate time and effort to get something for themselves. They just get it right there and then in the middle of the shift.
That must have been pretty amazing to get them right off the shift and then feel their bodies moving into at least some kind of state of relaxation.
Well, I have to say it didn't take any effort at all. Just from the first day that we showed up, and of course some people were more resisting being touched or whatever, but by the feedback of the ones that we did treat, everybody hooked on. We had long lines of people waiting to get a session. I started to do Douyin and Qigong exercises on the waiting line while my colleagues were doing the actual Shiatsu.
Sure.
It really ran like gunpowder, the people really loved it, and they realized they needed it, and they realized how useful it was. The very first time that we saw, I gave the head nurse of the COVID ICU center a 15-minute session. Okay. And I saw her the following day, and she stopped me in the corridor and said, listen, I really realized that how much we need this. I not only felt great during the session, but I felt great after the session. I worked 5 hours more than I should have. I was in a good mood. I realized that the people that received Shiatsu from the team, they were also in a good mood. I realized we didn't make any mistakes that day. And if there was something that was not right, we were able to solve it very smoothly. I went home. I relaxed. I had dinner with my husband. We had a nice chat. I had a good shower. I went to bed and I slept like a hadn't slept in a long time. And here I am again. It's my new shift, and I feel great. So so it's just a 15-minute session.
Incredible.
Had a very long effect. Yeah. Well, that people reported even better relationships with their close ones, with children, husbands, wives. Things were better at home because they were arriving in a better shape.
Yeah.
Emotionally speaking,
Sure.
It's beyond physical.
Yeah. And you had quite a team with you, right? You were like 10, 15 people. How many were you?
Yeah, well, when we started in the neonatology department, we were 10 people. And but then after COVID came up, we lost about half. We lost 5. And then I included another person that was not one of my students, but she had the skills. And so with 6 people, we did this about 2,500 sessions overall since 2019 till now. We have a very short intervention, 10-15 minutes, very deep, very focused. We do the energetic diagnosis in the first 30 seconds, 1 minute. It just comes from intuition what you need to work with this person.
Okay. We
do a protocol of head, shoulders, neck, arms, back. But we have like one aim that comes up from the energetic diagnosis. That could be from the back diagnostic areas of Masunaga, or just the picking up from the energy field which meridian we need to focus on. And that really works well. We could do about 4 or 5 people per hour. But again, we could not sustain that intensity of work for too long. So I more or less calculated, and it worked okay, that we can do maximum 2-hour shifts. And I would see 10 people in 2 hours. Some of the team would see 7, 6, 8. We have like 8 people per 2-hour shift, and then we had to stop. We had to go out, take a break, maybe have lunch somewhere, and then come back for another 2 hours maximum. So it's just maximum 4 hours a day.
That's plenty of contact, though, isn't it? 4 hours. I mean, you're talking about.
Yeah.
20
well,
people.
it's not only that it's 4 hours. It's about you calculate about 16, 17 people in 4 hours. And so we didn't do that every day. We did maximum 2 days a week.
Okay.
So and then what happened was that when we started to take this program, the same system, to the other hospitals throughout the country. Well, we had the added challenge that we could only go there for 1 day.
Right.
So we had to do as many people as possible, but we kept the same format. Like we work in the morning 2 hours, in the afternoon 2 hours, and then come back to the city.
Yeah.
Montevideo, where we live. But sometimes we were on the road for 3-4 days.
Whoa.
Yeah. But I'm very happy that and all this was only in the national health system. It's a public health. I'm very happy that we managed to get in to give a hand in such a crazy time.
So how many months were you working with this particular thing then in the COVID?
The most intensive part of that, let me see, 7 months.
Whoa.
7 months, pretty much full blast. Full blast was about 4 months, and then it was it started to
wind down.
Yeah.
And I assume you're in contact with everybody on the team. You're your own people. Yeah. Everybody's fine. Everybody's recovering from. I mean, emotionally, that's quite exhausting, isn't it?
Yes, but I think we provide ourselves from internal support, but we work on each other and we have regular meetings and we talk about the different things. I have to say that after we lost from the initial 10, we lost 5 and then we gained 1 more person. So the 6 people that we started, we ended up all okay.
Yeah. Mm-hmm.
We're all fine, and now we're all working as a team on different projects. That we have. We started before, and now we're continuing, or we started projects after the COVID subsided.
Great. Sounds like we need to do some more interviews, Diego.
Yeah, because now we're venturing into an amazing area. Like. I used to work in hospice, supporting patients that at the end of life stage when I was in New York. And after a couple of years of that, I said, I need to stop and start working on
healthy
pregnancy. I want to balance with the other end, and now what we're working with babies.
That's wonderful.
We're working with the mothers of the premature babies on improving breastfeeding rates,
right?
That are crucial for babies, and so that's another frontier, and we've seen a big impact on that too.
And whenever you're ready, the hospice, that experience would also, I think, be really helpful for a lot of people to hear your experiences about that, because.
Sure.
Generally speaking, people are quite afraid of death. And as soon as you're not afraid of death, you can do amazing work, right?
I am afraid of death. That's not what keeps me working. Actually, I started working with critical illness patients and hospice care just to deal with my own fears of death. And I realized that it was the way that I found to work on my own issues. And there is one thing I always look at. There's one part of the equation when you're giving something that looks like is altruistic or it looks like a big gift. You have to see, what is it that you're getting from it? It's never one way. And if you think it is only one way and you're feeling great because you're giving and giving and giving, I think you're fooling yourself and you're not really giving the best of you. The best that you can give is when you realize what you're getting in return. And, by working with these dying people, I was aware I was working on my own issues regarding death. And that way, we were even, we're balanced and equal. The person that's dying or receiving, and I am helping them, but I'm also getting something, and so we can look eye to eye, and there's no differential.
Wonderful.
So with babies, it's the same. I've seen everybody that's working with babies is because there's been some issue regarding birth or babies that were not born or the deaths in the family or something. So it's always good to look at the real motivation to do things. So
I'm looking forward to talking to you about both of those subjects, Diego, because it sounds like there's always subjects inside the subjects, aren't there?
Of course, yeah. That's why I love Shiatsu. It allows you to get all the opposing principles in the same bag, and the same unity of perception. So
wow. Diego, I want to thank you very much for taking time. and
My
sharing your
pleasure.
experiences, sharing wholeheartedly. Thanks very much.
Thank you very much. There's one thing that I want to mention, and is how many other programs have sprung up from what we did in Uruguay. You know, there are some in some countries this was already being done, or it was already in the making. But I feel that what we did was a catalyst for other colleagues to, you know, go out there and do amazing stuff in places like Hungary and France, which was already being done before. But it was beautiful to see how many of our colleagues got inspired to do this kind of stuff.
Fantastic.
And I want to congratulate them.
Diego, thank you very much.
Thank you. Have a great time.
Thanks. And see you sometime soon.